Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich. Carlos Saracito is interpreting the press conference in Spanish, and his interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. Yesterday, Governor Newsom announced new regional stay-at-home orders will go into effect in California to combat the dramatically increasing COVID-19 cases that are happening across the state. COVID-19 cases in California and across the country are exploding even before exposures connected to Thanksgiving gatherings have begun to be identified. To be clear, the new regional stay-at-home order Governor Newsom announced is not yet in effect in Santa Barbara County. The Southern California region, where Santa Barbara County is included, has not reached the critical 15% ICU bed minimum staffing and bed capacity trigger to make the order effective locally. Dr. Anthony Fauci, describing the inevitable upcoming Thanksgiving cases which will occur over the next few weeks as a surge on top of a surge. Nationally, daily hospitalizations passed the 100,000 threshold for the first time since the pandemic began, and tragically, nearly 1,000 Californians died of COVID-19 in the past week alone. Sadly, we are again looking at the potential collapse of our state medical system because of increasing COVID-19 cases. We must all unite together to bend the curve to preserve our hospital capacity and enable our healthcare system to treat the new COVID-19 patients that inevitably follow the spiking cases. The California Department of Public Health is evaluating county and regional ICU bed and staffing status on a daily basis and will be reporting the regional report cards on the State Department of Public Health website at covid19.ca.gov. The county will mirror this information on our own website at publichealthsbc.org. Under the governor's new order, if the critical ICU regional threshold is exceeded, businesses will have 24 hours to adapt to the closure requirements or new operating restrictions depending on the specific business sectors. The stay-at-home order will last for 3 weeks, at which time the state will project regional ICU bed and staffing capacity ahead for 4 weeks. If the projected capacity does not exceed the 15% critical ICU threshold, the regional shutdown will end. Counties will then assume their new color code assignment based on the COVID-19 case rate per 100,000 population and test positivity rate. If we all remain vigilant and can keep our local COVID-19 cases low, I'm hopeful we could emerge from the stay-at-home order in position to move directly back into the red tier. Like the original stay-at-home order in March, everyone is asked to stay home as much as possible, stop gathering with anyone outside your household, and limit your movement to essential travel only. Mitigating the risks of gathering with other people is not enough. We must all avoid mixing with people outside of our household whenever possible. When the regional stay-at-home order goes into effect, schools that are currently open will be able to continue to operate in accordance with the existing rules. Retail businesses will be able to stay open with customers restricted to 20% occupancy. Gyms and fitness centers can only stay open outdoors and with health precautions in place. Restaurants are limited to takeout and delivery only. Bars and wineries must close. Hair salons, barbershops, nail salons, and other personal care services must close. Museums and movie theaters, both indoors and outdoors, must close. Worship can continue to take place outdoors with health precautions in place. I know that many faith communities will continue to meet virtually. The stay-at-home order will have very serious economic impacts on local businesses. We can help reduce that pain by being very intentional about supporting local businesses. Fortunately, most retail businesses will be able to remain open at 20% capacity. Being intentional about making every discretionary holiday purchase at a local business is critical right now. You don't have to visit a local store in person. You can visit their website or simply call them on the phone and explain to the owner or employee that you want to keep your shopping dollars locally this year. Ask how they can help you place an order over the phone. This holiday season will make or break many local retail businesses. Amazon doesn't need our local dollars, but our local businesses do. Since local restaurants will be limited to takeout and delivery, now is the time to support your favorite local restaurant by ordering takeout more often. Many restaurants have, by necessity, successfully pivoted and embraced takeout and delivery service, so please support as many restaurants as you can during the next 3 weeks to keep them afloat during this very tough period. Business owners who need financial assistance should start with the state of California's COVID-19.ca.gov website. The federal government, the state of California, and the county of Santa Barbara are providing broad assistance to help small businesses and employers that have been impacted by COVID-19. As part of this initiative, state tax relief will be provided for businesses, including through sales tax deferrals without penalties and the small business hiring tax credit. The state will also be providing capital to the California Rebuilding Fund to support small business loans. The state is providing $50 million from the Small Business Disaster Relief Loan Guarantee Program and $50 million for the Small Business Loan Guarantee Program via iBank to provide loans to underserved small businesses. Small business debt relief assistance is available for existing Small Business Administration borrowers. The Santa Barbara County Board of Supervisors enacted a ban on evictions for commercial tenants through January of 2021 to parallel the state's residential rental protection legislation. These next few weeks are going to be very challenging, but I know our community is going to do everything that we can to prevent the spread of COVID-19 while supporting our local small businesses and our local workforce. I'd now like to introduce Dr. Joe Reynoso, the County Public Health Director.
Thank you, Supervisor Hart. Much has happened since our last press conference 2 weeks ago. As you are aware, we are experiencing significant increase in COVID cases and, as expected, in our numbers hospitalized and in particular our ICU placements. The average weekly sum of new cases has doubled from less than 200 in October to nearly 400 in November. While testing volume has increased in November, so has testing positivity. Testing positivity has doubled from 2.0% in October to 4% in the last week of November. We're seeing a few notable trends among new cases. Most are working age adults aged 18 to 49 years of age. The most common occupation is clerical and management. Cases most commonly reside in Santa Maria, followed by Santa Barbara, then Lompoc. We're also experiencing an increase in outbreaks. The number of outbreaks has been increasing since the beginning of October. In the last 2 weeks of November, there has been 12 new outbreaks opened in congregate settings. These outbreaks have been driven by new cases among staff. In the month of November, there have been 7 outbreaks tied to businesses across multiple sectors. Total number of cases from business outbreaks in November at 35, with a range from 3 to 12 cases. I anticipate that we will have more difficult days ahead as we grapple with the impact of rising cases in our community and around the state. It is inevitable in the days ahead that we will be in the regional stay-at-home order. We will then issue a local health officer order to remind everyone what is permissible and what is not allowed as soon as we receive notification from the state. In conclusion, I'd like to remind everyone that we still need to continue to wear our masks, maintain at least 6 feet distancing from others, wash our hands, and stop gathering with those not from our household. These are choices and behaviors that will keep everyone safe. Thank you.
Thank you, Dr. Joe Reynoso. Dr. Henning Ansorg, the county's public health officer, is also here with us today.
Thank you, Supervisor Hart. Good afternoon, everyone. I would like to take this opportunity and report a little more on our upcoming COVID vaccines and vaccination efforts. As most of you are aware, there are currently 2 vaccines in the review process by the FDA to receive emergency use authorization. Once the FDA grants this authorization, the Advisory Committee on Immunization Practices of the CDC, known as the ACIP, will review the original safety and efficacy data and issue their recommendations on utilization of these vaccines. We anticipate that the FDA will approve the Pfizer vaccine by the end of next week. ACIP, or the Advisory Committee, will likely need an additional 2 days to review all the science and give their recommendations. Pfizer already has a certain amount of vaccine vials ready for shipment. If all goes according to plan, Santa Barbara County is slated to receive an initial batch of 3,900 doses around December 18th. Due to the sub-freezing transport requirements, the shipments will go from Pfizer directly to our local hospitals and the Public Health Department. The Public Health Department has created an equitable distribution plan for the county to make sure that frontline healthcare workers will have access to the vaccine initially. This will be followed by first responders and elderly community members living in nursing homes who have the highest risk for developing severe disease if they are infected by the coronavirus. We will follow the prioritization algorithm that has been created by the CDC and the CDPH, which is the California State Health Department. A second vaccine developed by the company Moderna is expected to become available about 10 days later. So we might receive shipments of this Moderna product by the end of December or in the early days of January. There are several more different vaccines in clinical trials right now, and they will likely become available one by one in the early spring. Once our highest risk recipients have been immunized, the general public will be able to receive their vaccinations. Depending on the availability of more vaccines, we will be including pharmacies, primary care clinics, urgent care centers to our public health vaccination spots for this immunization effort. The Center for Disease Control on Wednesday updated their recommendations on the length of quarantine for individuals who may have been exposed to COVID. The recommendation states that it is still safest and the gold standard to complete a 14-day period of quarantine after contact with a COVID case. At times, when the 14-day period is not feasible, the new CDC guidance does allow for a shortened 10-day period with ongoing vigilance for symptoms until the 14 days are completed. The CDC even gives a third option for an even shorter 7-day period, providing a COVID test on or after day 5 results negative. For Santa Barbara County, we will not implement the 7-day quarantine option because the risk of still coming down with COVID after the 7 days, even with a negative test result, can be as high as 12%, according to the modeling data used by the CDC. We determined that this is an unacceptably high risk. The CDC gives the county health jurisdiction the authority to establish local quarantine options, and we decided to continue with 14 days as the gold standard and the safest time frame, however, allowing for a shorter 10-day quarantine in situations where 14 days are not feasible. Thank you.
Thank you, Dr. Azorg. Suzanne Grimacy from the county's Department of Behavioral Wellness is also here today to tell us about the importance of getting outdoors during this very stressful time.
Thank you, Supervisor Hart. Yesterday's announcement of the regional stay-at-home order has only strengthened our need to continue to focus on our mental health. As the governor stated yesterday, getting outdoors and staying active will be critical, and he is so very correct. We couldn't be luckier than to live in a community where we have so many opportunities to get outside. Here in Santa Barbara County, we have easy access to hiking paths, outdoor areas for running. We have well-lit bike paths for day and even evening bike rides or walks. We have beaches, we have parks, and we have so many more opportunities. Getting outdoors is even more important now than ever before. There's growing research that tells us that even a simple walk outside can help to reduce depression and can boost our energy. So get out, keep a safe distance from others, keep your mask with you, perhaps carry an extra mask with you in case there's someone else who needs one. When you're out, be sure to notice the sights and the smells and the sounds of the outdoors. Walk your dogs. And if you get out in the evening, enjoy looking at the festivity of the Christmas lights that are hung around town on so many homes and businesses. Other reminders for taking care of our mental health: work breaks into your days. Take time to unwind, even if you have to schedule it. Limit your time watching or reading the news. Stay connected with others, and if you feel like you need extra support, reach out. Nobody has to do this alone. The Behavioral Wellness Crisis Access Line is available 24 hours a day, 7 days a week at 888-868-1649. And the Community Wellness Team remains available to call and get connected with mental health resources. That number is 805-364-2750. Lastly, a reminder for the seniors in our community or those who may know a senior: the Behavioral Wellness Department and the Community Wellness Team have launched a senior holiday phone bridge program. Recognizing that this time of the year is challenging for everyone for a lot of reasons, but for our seniors who look forward to time with family and visits, and so many that may be in skilled nursing facilities or other places where they can't have visitors, this can be an extra lonely time of the year. The Holiday Phone Bridge program pairs seniors that are interested up with a volunteer that will call once, twice, or on a regular frequency just for a warm phone call, for coping skills, for updates on COVID, or for ideas for activities during the season. So we encourage people to reach out to the Community Wellness Team to make connections to the Phone Bridge program. Again, the number is 805-364-2750. Thank you.
Thank you, Ms. Grimacy. We'll now go to questions from the room. Mr. Devine?
Just to clarify, Supervisor Hart, when you said if the regional stay-at-home order is triggered, would it be 24 hours till businesses have to shut down, or 48 hours?
24 hours.
Okay. And then another question I have is, obviously, we're in December, Christmas is coming, and what can people do today to save Christmas so it's somewhat normal as opposed to what we anticipate it could be like if the cases continue to rise? Or is it already too late to have a normal Christmas?
This is not a normal year, and that includes all the holidays. And unfortunately, we're in a position today where we're looking at a shutdown order, and that will continue. You know, if that occurs next week, early next week, that will continue through Christmas. And we're just going to have to figure out other ways to connect with family and friends in meaningful, real ways that are not personal and in contact with each other. There is no other option, and there are lives at stake at this point. 1,000 Californians died in the past week alone. That is the beginning, not the worst case scenario, as cases continue to spike, and we have not felt the impact of the Thanksgiving gatherings that occurred. And so maybe that's the bottom line, is people should think about the consequences of gathering with family members and the importance and necessity of that. But the potential consequences of that are far greater. The fact that you wouldn't have a family member's birthday to celebrate next year because you chose to celebrate Christmas this year is, in my mind, not worth that trade-off.
And if the governor issues that regional stay-at-home order, which we're all expecting very soon, what would this mean for modified holiday events across the county? There's a lot of events going on physically distanced, but would those all have to get shut down?
The shutdown order is a stay-at-home order. If it is triggered, folks have to stay home and only go out for essential trips.
And then over the summer, the Board of Supervisors agreed to lease that old Sears building in La Cumbre Plaza so it could be used if hospitals reach capacity. Where does everything stand with that alternate care site in the county right now?
What we've learned in that time since that was contemplated is that the biggest limitation on hospital ICU capacity is actually staffing, not the physical space. The hospitals have a flex capability in their buildings to add ICU rooms, but as the virus has gotten out of control across the country, staffing has become a critical issue, and that is a limitation that we have to exist with. We can't train nurses and ICU emergency doctors in the next couple of weeks. So the only strategy we have is to reduce mixing, to reduce the spread of the virus, to maintain capacity in hospitals to protect against that surge.
And then lastly, my two questions for either of the doctors, but will Santa Barbara County take patients from other counties in our region if the counties get hit hard with their ICU capacities?
I think that is a complicated question, and we as a region have been very supportive of one another in the counties. And if we have the capacity, I believe that the hospitals will attempt to accommodate, keeping in mind to also safeguard the available beds for our local residents.
Thank you.
Thank you, Mr. Devine. We'll now answer questions on the phone.
Yes, first up is Tom Bolton with Newshawk.
Thank you very much. I'd follow up on Blake's last question. Do you have a census of how many patients either have been sent here or are currently here from other counties?
Do you?
About 10 days ago, College Hospital accepted 2 patients from Imperial County that were needing ICU care. But because of our rising cases, the local hospitals decided to no longer accept more patients as of right now.
Okay. My second question, I'm hearing a lot of people questioning why Santa Barbara County was included in the Southern California region with counties such as Riverside and San Bernardino and Imperial, which obviously have much more serious situations. Not to minimize what's going on locally, but I'm wondering, in your judgment, how appropriate you feel it is for the county to be lumped in with those Southern California counties.
I think that's the natural first reaction that everyone has had, is that given the caseloads in Los Angeles County, the reaction is disappointment and frustration that would be included in that larger Southern California region. But when Dr. Dorwinoso and her team looked at this more carefully, the Southern California region is actually in the middle of the trend statewide. The worst area in the state in relation to ICU capacity is actually rural Northern California. And the Bay Area is doing the best. But the range between the best and the worst is a little bit, about 6%. So it fundamentally doesn't change where we land in relation to other counties if we're going to be lumped into a larger region for the purposes of distributing medical capacity across a broader area. So while our individual case count today is much better than those places, that is not a certainty to stay that way over a relatively short period of time. There's been tremendous change in a very rapid period of time. So, I think what we are focusing our efforts here locally on is working with the California Department of Public Health to figure out an exit strategy. When the shutdown occurs, we want everybody to comply. We want to keep our case numbers low. We want to keep our hospitalization as low as possible, so that when there is an opportunity for that to end, that we can quickly get back on track and reopen businesses. But I understand and empathize and felt exactly the same way when I first learned that information.
Yeah, I guess it all makes sense, Greg, but I'm wondering whether as the public health department officials particularly, if they agree with that approach of just grouping these very large regions all together when, until now, we've been looking at it on a county by county basis in terms of the tiers and other ways of deciding, what level of shutdown was going to occur.
So, a few months ago, when the state anticipated that we would need to reach this point of a regional approach, they did ask both Dr. Ansorg and I to weigh in, and there was a survey about between 3 different options for regionalization. And we had voted that it makes more sense for us to be grouped on a smaller scale, perhaps along the Central Coast counties, given the similar economies, size of population, and whatnot. But alas, given the other more broader implications of a bigger regional access, regional capacity, the ultimate decision was to go with the 5 health officer infrastructure coalition as a region.
So I'm understanding that you all advocated for a much smaller regional, perhaps a Central Coast, but were essentially overruled by the state.
That is correct.
Okay, thank you very much.
Thank you, Mr. Bolton.
Thank you, Tom. And next up, we're going to Fabiola Navarrete with Tu Tiempo Digital.
Yes, hello, good afternoon. Supervisor Hart read the list of businesses that will remain open, but sorry, I missed or maybe I didn't hear about malls. I just want to know if malls are gonna stay closed or open at 20% capacity.
Malls are allowed to remain open at 20% capacity.
Okay, thank you so much. And my next question, well, I already asked you this, I think, in the last conference, but we're still receiving many complaints about parties that have taken place in some ranch with many guests, and people is still concerned. They want to know what number they can dial to report this, and they want to know if these people is gonna get a fine or some ticket, for organizing this kind of parties.
If something like that is happening right now, I think the best way is to call 911 and to report it, and law enforcement will respond, and they will tell people in no uncertain terms that they're in violation of the public health order and that they needed to disband immediately. And if there is, willful failure to comply with those orders, law enforcement has tools to make sure that doesn't happen. And there have been consequences for folks who violated the orders.
Okay, they will have consequences. Okay. Thank you so much. That's all. Thank you.
Thank you, Ms. Navarrete.
Next up, we have Brooke Holland with Newshawk.
Hi, yes, thank you. This question is for Dr. De Reynoso. I was wondering if you could provide some insights into what is driving the outbreaks tied to those 7 businesses and the outbreaks tied to those 12 congregate living settings.
Unfortunately, COVID-19 is prevalent in our community. There is widespread transmission as people are in their daily activities, in their social activities, perhaps are not wearing masks as they should or appropriately as they should, perhaps not observing the 6-foot distancing, having social events inside, and gathering with multiple people. Lately, I have been made aware that there are traveling sports team going to various jurisdictions and states participating in tournaments, and that is a worry. And my thinking is that as we delve deeper into these activities, that may be one of the driving reasons for our continued increasing cases. So the bottom line is that as we maintain our quote unquote normal list of activities, we are perpetuating the spread of disease. And as Supervisor Hart mentioned earlier, we really need to buckle down, double down, and do our best effort to restrict our movements and keep it to the essentials. And while we do those essential, maintain our distancing, wearing our mask appropriately, and limit our gatherings. And I think that while we continue those, we will have continued increases in cases.
Okay, great. Thank you. And with the continued increase in cases, can you explain what is being done to conduct rapid case identification and to trace contacts for additional COVID testing? And have any of these efforts been like adjusted, or what are some things that have been learned with these compared to like the early months of the pandemic?
We are more efficient and competent and have the right staffing to do contact tracing. We are continually meeting the state criteria in quickly responding to positive cases, the interview with the cases, as well as identifying the contact for contact tracing. So we have an incredible group of people in our COVID-19 unit that does the contact tracing as well as the isolation and quarantine efforts. With regards to testing capacity continues to be available throughout our county, and even so, we are working on further expanding that capacity in our county.
Okay, great. And then my last question is kind of switching topics, but I was wondering if County Public Health is considering releasing the daily COVID numbers to the public on weekends and holidays, especially since we are experiencing a significant increase in cases and a regional stay-at-home order could kick in.
That would be a consideration, but for this point, the daily cases, reporting the cases takes a lot more than just grabbing the numbers and posting. So at this point in time, we are not seeing the need. Many jurisdictions across the state continues to not post weekend numbers. When we get the numbers, we have to do the case investigation and attach the cleanup of those numbers. And so for right now, we are not seeing a need, but that could change in the future.
Okay, thank you so much.
Thank you, Ms. Holland.
Next up, we're going to Laura Place with Santa Maria Times.
Hi, everyone. So my first question is just to get a bit of clarification about the timing of this regional stay-at-home order. Is it your understanding that the order, if our hospitalization numbers for today for our region were reported to be 15% or less, could we, then within 24 hours of tonight have to implement that order? Or is it not, even taking effect for any regions until tomorrow?
The order is in effect tomorrow at 12:59 p.m. And to the best of our estimation, we don't anticipate the region to be issued that health officer order, but a lot can change. We are grouped as you may have heard earlier on with all of our Southern California counties, and counties are working, our hospital systems are working on increasing that ICU capacity. So in addition to being aware that all of our hospital systems have to make some adjustments to maintain that hospital capacity, my feeling in discussion with a few of our colleagues across other counties this afternoon, that we are really not anticipating a notification at least today or tomorrow.
Okay. Yeah, that differs a bit from what I've heard, at least in SLO County. I know Dr. Penny Bornstein, I think yesterday at their press conference, was saying maybe even within 1 or 2 days. So, yeah, but you think it would take at least a few more days before that kicks in?
Right. I think the thing to remember about ICU capacity is that it really can turn on a dime. We can have an influx fairly quickly, but our best estimation that it could take anywhere from 2 to 4 days.
Okay, great, thank you. My other question is about a report on the daily status update a couple days ago that stated that there were some delays, or backlog, I should say, in COVID test results from Quest. I was wondering if that is an ongoing backlog, and what may have caused it.
The bulk of our county testing is not from Quest. It is using the Perkins-Elmer platform at our 3 community testing site. However, there are providers and our own public health walk-up testing sites for critical infrastructure workers. We do use Quest. Quest is experiencing a national backlog due to the increase in cases.
Okay, so it's an ongoing backlog still?
Correct.
Okay.
But again, that is a very small percentage of our county's overall testing numbers.
Got it. Okay, thank you all.
Thank you, Ms. Place.
Thank you, Laura, and that concludes our question.
Thank you for those questions. The Board of Supervisors will hear a COVID-19 update from the County Department of Public Health at 9 a.m. next Tuesday, December 8th. Our next press conference will be held a week from today at 4:30 p.m. on Friday, December 11th. The Public Health Department will issue press releases to update the media and the public about breaking news. These press releases will also be posted on the county website at publichealthsbc.org. It's more important than ever to continue to practice these 3 simple personal steps every single day. This is the time we need for everyone's cooperation to stop the increasing spread of the virus. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. Number 3, if you feel sick, stay home. Don't go to work and isolate yourself. Call your doctor or clinic and follow their medical advice. While this is, without question, a very difficult moment, it is up to us how we respond to the challenge. I know with certainty we are stronger together, safely apart.